All right, March is Colorectal Cancer Awareness Month, and for 10 minutes to your health, that's what we'll be talking about today. So gastroenterologist with Riverside Medical Center, Dr. Jamila Wynter, zooms in to tell us all that we should know about this illness. Good morning to you, Doc. How are you?
Good morning. Thank you for having me on, Debbie.
Doc, we were talking a while ago off air about what a gastroenterologist is. Can you explain that for me, please? Because it sounds pretty complex.
It sounds complicated, but it's pretty simple. So a gastroenterologist is a doctor of gastrointestinal and digestive diseases and disorders.
And the colon cancer, it begins in the large intestines, right? Tell us, give us a description and a definition about colon cancer.
That's right. So colon cancer, as it suggests, is a cancer or abnormal growth of cells in the lining of the colon. And the colon makes up the large intestine, which is the lower part of the digestive tract.
Okay. What are some of the causes, Doc, of colon cancer?
So we think that colon cancer is related to several environmental factors, such as obesity, being sedentary and living an inactive lifestyle, and diet is a big part of this. So we do think that having foods that are high in processed foods, red meat, fat, sugar can also increase one's risk of developing colon cancer.
Wow. And Doc, does it happen over time? Like, what are we looking at? The contribution of eating processed foods from, a young age to when you're what, 60 or over? Yeah?
Yeah. So traditionally, colon cancer was a disease of older people. So we used to think that it would take decades to develop over one's life. So the average age being anywhere between 50, 60, 70. But unfortunately now we are seeing an increased incidence in younger patients. So now it can develop in age 30 or 40 based on data that we've had over the past couple of years.
And what does this data say? Is it because of genetics or is it because of habits and trends?
Right. So the incidence of colon cancer has doubled since 1995, and we think that means that there is some environmental changes, particularly what we're eating, so what we're consuming. We're eating more foods that are unhealthy for us, low fiber diets, more processed meals. We do think obesity and smoking and actually very high alcohol consumption contributes to this as well. So all of these factors are probably causing the population to have colon cancer at a younger age.
Wow. I was having the discussion off air with my floor manager, and he asked me the question. He said to me, so a woman can get colon cancer too, because isn't that like a man's thing?
No, that's a misconception. Women are also at risk. Actually, colon cancer is the third leading cause of cancer in Jamaica.
Wow.
And in both male and females combined. So it's a fairly common cancer in both genders.
Wow. You mentioned the age 35. Is there an age, though, that we ought to be checking out our colon?
Yes. So the screening guidelines say that we should be getting a colonoscopy at age 45 years old. So it used to be 50. As of 2021, the guidelines have changed. So screening should be done at age 45. However, if you're having symptoms such as rectal bleeding, weight loss, abdominal pain, changes in bowel habits, then you should probably be getting a colonoscopy at that time. If you have any changes in your symptoms or bowel habits, that is a reason to seek care and get a colonoscopy.
All right. You went right into the symptoms, Doc. Is there anything else I should be looking for?
Yeah. So the most common, the top 4 signs, again, rectal bleeding, changes in bowels, weight loss, and stomach pains are often signs of early signs of colon cancer.
Well, Doc, the average Jamaican will tell you, say, boy, I get stomach pain all the time. I have gas all the time, so.
Right. So the way I tell my patients, if there's a change in how you're feeling, right? So I know people who've had pains all their lives, or they're more prone to diarrhea or constipation, but if there's an abrupt change, then that is a reason to talk with your primary care doctor or gastroenterologist that something's not right.
Okay. Walk me through the process and the diagnosis as well. I mean, it's
Right.
morning TV, so you know, but I know you can clean this one up for us to understand even better. Tell us about the process.
Yeah, so a colonoscopy is a tool in which we use to diagnose and also prevent colon cancer. So a colonoscopy is a long, flexible tube with a camera. You're completely sedated in a procedure room, fully asleep, and you have to clean out the day before. But basically, the camera is placed in the rectum into the colon to see if there's any abnormal growth. Now, the important thing to know is that they are benign or non-cancerous lesions in the colon called polyps. And those polyps can lead to cancer down the road. But the most important thing is if you get a colonoscopy, we can remove those polyps right there and then during that examination.
Okay, so if you identify the polyps, they're benign, right?
Yes, they are benign, they're non-cancerous, but if left in the colon over decades, then they can turn into cancer. So I always tell my patients, colonoscopy is not only for diagnosis of colon cancer, but it is a preventative tool.
Gotcha. Okay. Personal responsibility, though, Doc. You know, some persons will say, okay, fine, we need to eat well, that's for sure. We need to not be
Right.
smoking and drinking alcohol. There's something that growing up in Jamaica, as a Jamaican, you'll get right before you go to school, which is what we call a washout or a clean out. In our adult years, should we also be doing that consistently as well? I mean, how often should we be doing our own part, you know, to clean our colon?
Yes.
Yeah.
So honestly, the only evidence that we have is just having a high fiber diet. So having a diet that is full and high in fruits, veggies, having a lot of green leafy veggies, you know, salads, spinach, kale, those types of foods, fruits. If your diet is high in those types of foods, then we do think that reduces your risk of colon cancer and polyps. There's no indication that doing a quote unquote colon cleanse to clean out your bowels helps in that process at all.
Gotcha. Okay. All right. So, Doc, you know, somebody gets diagnosed with colon cancer. Is it a death sentence automatically? What are the stages and what are the treatments as well for it?
That's a great question. So there's actually 5 stages of colon cancer. So the hope and goal is with colonoscopy and routine colonoscopy, we can catch it at an early stage. So stage 0 is basically when the colon cancer is just confined to the colon. So that means we can remove it endoscopically, actually, during a colonoscopy. However, when you reach stages 1 and 2, then that means the colon has invaded the lining of the colon wall. And this may require surgical treatment. And then more advanced stages, including 3 and 4, is when the colon cancer has extended into the lymph nodes and potentially outside of the colon and metastasized to other areas of the body. And unfortunately, at that late stage, you may be looking at a poor prognosis, and that requires chemo radiation.
Wow. There are so many persons right now, even inside the studio, who, you know, they're a little concerned about the process, especially our gentlemen. Maybe it's a cultural thing. You know, what would you say to them?
Listen, I tell my patients the hardest part about this whole process is, you know, cleaning out the colon the day before, drinking the colon cleanse. But the procedure itself is very well tolerated. You're asleep, you're under sedation. It's very safe and it's very quick. And it can save your life.
Yeah. Do I wait until 45 or do I head to a medical center to get this done before?
Right. So this is my recommendation. If you're asymptomatic, right? So you need, like I suggested before, or I told you before, and you have no family history. So family history is a big piece of this. No family members have had a history of colon cancer. Then you can wait for age 45 years.
Gotcha.
45 years old. However, if you're having symptoms like rectal bleeding, anemia that's unexplained, weight loss, pain, or you have a family history of colon cancer, then you may need to get it done sooner. I advise that you talk with your healthcare provider about the timing of your procedure.
Thank you so much, Doc. You are so thorough. Thank you so much. We learned a lot this morning. Wow. Gastroenterologist with Riverside Medical Center, Dr. Jamila Wynter.
Thank you so much for having me.
All right, after the break, we get the details on Poetry in Bloom. Stay with us.